Hi, everyone. This is Nicole Jorwic, the Senior Director of Public Policy from the ARC of the United States. Glad to be joining you again. A little bit different background. I'm back home visiting my brother and my family. Before I get to COVID-19 and the update that we have there, something else to note that I wanted to make sure to note this week from our Director of Income Policy, Bethany Lilly, is that the Social Security Administration has announced that they are restarting continuing disability reviews, or CDRs. However, they have stated that no adverse reaction or action will be taken based on these determinations. So for at least a few months, we're assuming that people who are on Social Security won't get kicked off if they don't have the documentation. We do think that this is dangerous, especially considering how many hotspots there are, since many people will need to see their doctors and update materials for reviews to make sure that they can maintain eligibility. And so Bethany is leading efforts to advocate that the Social Security Administration return to their prior hold on those CDRs, or continuing disability reviews. So we will be monitoring that. And now to get back to the regularly scheduled COVID-19 policy update. Since the COVID-19 pandemic started, Congress has passed several legislative packages, as I've outlined on these calls. Those pieces of legislation had some beneficial provisions, but broadly ignored, again, the needs of the disability community, their with disabilities, their families, and the workforce. The House did pass a bill, just as a reminder, on May 15th, which seems like a long time ago now, that includes the top four priorities of the ARC that I'll outline. But again, the Senate has not acted on that bill. They have had since May 15th, and thus far there have been no alternatives, no action yet in the Senate. We do know that both the House and the Senate are on recess after the 4th of July holiday, and neither will be returning for a regular course of order until July 20th. And that's when the Senate will begin to negotiate. So those negotiations have not even begun, which means we're really concerned that senators still don't understand how much of a crisis this still is, and again, what the needs of people with disabilities are. I know that cases are up in many states, including yours, and it's very important to remind your senators that the disability community is essential and that our needs must be considered in the next package. The top priority for the next package continues to be the dedicated funding for Medicaid home and community-based services. This funding is necessary to serve people with disabilities in their homes and communities, and will also assist with providing better wages and recruitment and retention for the DSP, or direct support professional workforce. Access to home and community-based services will limit the risk of people with disabilities being put into institutions or other congregate settings, which remain a hotbed and real concern. We're looking for the dedicated funding that was included in the HEROES Act in Section 30103. That funding is for 1 year of additional funding so that states can do those things like support the workforce and provide access to those services for those who are currently receiving services and those who are eligible for services. Personal protective equipment for the workforce is also a top priority. It's urgently needed to protect the health and safety of people with disabilities and the critical workforce. We know that we need to see legislation that ensures that DSPs are designated as essential workers so that they can get access to the personal protective equipment and medical supplies that they need, because the services that they provide cannot be done from 6 feet away. The HEROES Act also includes language that would include direct support professionals in that category of essential workers, so we can highlight that to the senators, that the House did include that in their bill. DSPs do work every day that is essential, and the value of the workforce has long been overlooked, and in the face of the pandemic, this must be addressed, and then we must turn back to it post-pandemic. Paid leave for all caregivers remains a priority. Family caregivers continue to scramble, especially as other states are reopening and shutting down, and need access to paid leave and paid sick days to help their loved ones. Currently, some parents can take time off to care for their loved ones with disabilities under the paid leave that was passed in the bill that passed in May, the CARES Act, in March, the CARES Act, but siblings, grandparents, and other family members cannot. many parents were left out of the legislation because of paid leave excluded many employees from the protections of paid leave. So paid leave for all caregivers is a major priority. We believe that the new legislation should include paid time off for all family caregivers. And in terms of economic impact or stimulus payments, Congress passed those payments for many people in the CARES Act as well in March, but did not include adults who are claimed as dependents, which includes many people with intellectual and developmental disabilities. We are hearing that Congress may be considering additional stimulus payments, and it is imperative that the barriers that existed are eliminated from the outset so that all eligible people with disabilities have access to this fund. That's just a refresher on our top 5 priorities. These are the messages that need to get to your senators. We are hearing some interest in dealing with these issues, but the more that they are hearing from in-state constituents, whether it's organizations or individuals, the better chances that we have of actually getting this over the finish line. They come back on July 20th. There will only be about 2 weeks of work. And so it's really important that between now and July 20th, and then July 20th after, we're keeping the pressure on these issues. I know that it seems like, and I feel like I've been talking about these same issues over and over, and that's because they still have not been included. And so it's up to all of us to keep reminding the Senate what they need to do, to keep reminding Congress what they need to do, so that people with disabilities, their families, the direct support professional workforce, and service providers remain intact and remain supported in the face of the pandemic. Thank you and be well.